Hello everyone, today we will discuss neoplasia. This is the first video of the neoplasia series. Now studying the nomenclature. What is the definition of neoplasia? It's abnormal mass of a tissue, the growth of which exceeds and is uncoordinated with that of the normal tissues and persists in the same excessive manner after cessation of the stimuli which evoke the change. Now to break this definition down, it means that normally there is a stimuli which causes a growth of a tissue, but here there is abnormal mass of the tissue and its growth is more and is uncoordinated with that of the normal tissues, and after even the stimuli has been removed, the growth continues. Okay, now the tumors, they are basically of two types. There is benign, there is malignant. Now going to the benign tumors, for this we use suffix of oma to name it. Like if we have benign tumor of fibrous tissue, it will be named as fibroma, and if it is of cartilaginous, example, it is chondroma. Now going to the malignant tumors. Now malignant tumors, if they are of mesenchymal origin, that is, you have muscle origin, bony origin, these are named as sarcomas, like that of chondrosarcoma, osteosarcoma. And if the malignant neoplasms, they derive from the epithelium, they are named as carcinomas. Now if the epithelium is glandular, these are named as adenocarcinomas, and if the epithelium is squamous, it is known as squamous cell carcinoma. Now going to the differentiation and anaplasia, another terminology used. What is differentiation? Differentiation means the extent to which the neoplastic cell resemble the normal cell, both morphologically and functionally. And anaplasia is just the lack of that differentiation. For example, the benign tumors, they are well differentiated, whereas the malignant tumors, they are known to depict the features of anaplasia, and they also range from well differentiated to undifferentiated. Now what are the features seen in anaplastic cell? There is pleomorphism, that is variation in the size and shape. The nuclei will show hyperchromasia, clumping of the chromatin. There will be increased nucleus to cytoplasmic ratio. There will be presence of nucleoli. Mitosis will be atypical and bizarre. There will be loss of polarity seen, and other features like giant cell necrosis can also be seen. Now in this picture, we can depict the features of anaplasia. Like we can see the large cell, there are small cell also present, there is polymorphism, there is a tumor giant cell also present. So according to this, we can see what are the features of anaplasia. Now going to the dysplasia. What is dysplasia? This is disordered growth of the epithelium characterized by cytological and architectural changes. According to dysplasia, we name the term carcinoma in situ. What is carcinoma in situ? It is dysplasia which involves entire thickness of the epithelium but doesn't breach the basement membrane. If the basement membrane is breached, the tumor is said to be invasive. So key line over here is basement membrane. If it is intact, it is carcinoma in situ, and if it is breached, it is known as carcinoma. It is invasive. Now going to the local invasion. Normally all benign tumor, they will grow as a cohesive expansile masses, and they'll be localized to the site of origin. They will have a fibrous capsule. Now the invasiveness is mainly a feature of malignancy rather than benign tumors. If even benign tumors, they will cause local invasion and will have a pushing border and not an infiltrating border. Infiltrating border is a feature of malignant tumors. Now going to the metastasis. This is an important terminology. These should be distinguished from the local invasion. These are the tumor implants discontinuous with the primary tumor. The word discontinuous is important. If it is continuous, it will be named as local invasion. If it is discontinuous, then only we will term it as metastasis. And only malignant tumor metastasize, benign tumor do not metastasize. But there are few exceptions that some malignant tumor do not metastasize. Examples are gliomas and basal cell carcinomas. The pathways of spread for the metastasis of the cancer are three. There is direct seeding of the body cavities or surfaces, there is lymphatic spread, there is hematogenous spread. Now first is the seeding of the body cavities. What are the body cavities? They are peritoneum, pleural, pericardial, subarachnoid, joint spaces. These are the body cavities. So seeding of such cavities can occur. Example important of this is ovary carcinoma. We have ovarian carcinoma which causes seeding of the peritoneal cavity and causes a condition known as pseudomyxoma. Uh, sorry, the pseudomyxoma peritoni is due to appendiceal carcinoma that fills the peritoneal cavity with a neoplastic mass. Now going to the lymphatic spread. Lymphatic spread is the most common pathway in any metastasis. And also to note that mostly lymphatic spread is the spread of carcinomas. Carcinomas mostly spread by lymphatic spread. And it is classically seen in the breast carcinoma. And in breast carcinoma, we check for axillary lymph nodes to look for the metastatic deposits, and it is also important for the future course of the disease and therapy in any carcinoma. Now what is the sentinel lymph node? It is the first node in the regional lymphatic basin that receives the lymph flow from the primary tumor. That means this sentinel lymph node will be the first affected lymph node of that carcinoma. So we can check the sentinel lymph node to know whether it has metastasized lymphatic by a lymphatic route or not. Now third is the hematogenous spread. This is typical of the sarcomas, but it can be seen in the carcinomas like renal cell carcinoma and hepatocellular carcinoma. They spread by hematogenous route. Now, after discussing this, we should understand what are the difference between the benign and the malignant tumors. Now, for the benign tumor, firstly, we will understand the clinical and the gross features. The boundaries of the benign tumor are encapsulated, they are well circumscribed, and the malignant tumor, they are poorly circumscribed and they are irregular. The surrounding tissue is often compressed in case of benign tumor, whereas a malignant tumor, it is invaded, there is infiltrating borders. The size of benign is small, whereas of the malignant is comparative to it is large. Secondary changes can occur in both, but is less in case of benign. Now going to the microscopic features, the anaplastic features will be less in the case of benign, will be more in the case of malignant. So pattern, it resembles the tissue of origin, and malignant, it doesn't resemble. It resembles less. Basal polarity is retained. Pleomorphism is not present in benign tumors. The nucleus to cytoplasmic ratio will be normal. The pleomorphism and isonucleosis will be absent. Hyperchromatism will be absent. Mitosis can be present, but mostly it will be typical. It will not be atypical or bizarre. Tumor giant cell can be present. These all features are more in case of malignant. And chromosomal abnormalities are more in case of malignant, and function of the organ, the tissue will be well maintained mostly in case of benign, but will be a bit abnormal, or it can be according to the stage till which it affects that tissue. Then the growth rate is usually slow of benign, whereas it is rapid in case. Local invasion, we know it is less in case of benign than the malignant. Metastasis is always absent in benign, and prognosis is good in case of benign tumors. This was the first video of the Neoplasia series. Do like, share and subscribe to my channel. Thank you. Do check for further videos regarding this topic. Thank you.